need because of risk of complications, and focusing on the long-term care facilities and getting those immunized and partner with Walgreens for that. But also then we want to make sure we have that healthcare infrastructure maintained. So looking at the frontline workers who are treating COVID patients on a daily basis. So the ICU docs, the care teams there, the COVID units, the respiratory hubs where we diagnose in the ambulatory environment. So making sure all those caregivers that are in those arenas get vaccine first. So we're in that phase of rolling that out, which is the 1A phase. Also, partnering with anyone who is not just ThedaCare employee, but operates and functions in our hospitals and our care facilities, and helping get them immunized also.
Okay, so this is an exciting moment for us. We've been in this pandemic now for 10 months or more. Dr. Brooks, you've been doing this quite some time in infectious disease. What does this vaccine mean for you as a milestone?
Yeah, I think this is really a key component into us being able as a society and local community to control the pandemic. You really have to compare this to other types of outbreaks, influenza, polio, and things that really needed this type of an answer to stop the spread of the disease in the community. As we all know, this has had a profound effect on us, both locally, nationally, and globally. There really has been no effective treatment for the virus. So really the vaccination is going to be the key part in preventing this and getting everybody vaccinated over the next few months to get us to that point where the virus can no longer sustain itself and continue to infect new patients. Gets us back to at least more of a normalcy that we're hoping to get to as a society. So it's a huge thing, and the rapid pace that this was developed is really historically unique, never been seen before, quite an achievement.
Absolutely. So let's discuss just a little bit of background about these vaccines that we're seeing right now. 2 have been authorized for the emergency use authorization. So Dr. Cockley, can you tell us what that means? There's been a lot of conversation about how quickly these vaccines have been developed. So what does that emergency use authorization mean? And can you talk about the safety of these vaccines?
Yeah, so great. Thanks for asking, Cassandra. And I may rely on a little bit of Dr. Brooks to fill in some also. But really what's gone on, and they've used technology that's been around. So, for the SARS vaccine, and process used years ago, using that technology. So it's not different. Really, you've gone through all the stages that should be. That level 1, does it create harm in animals? Look at safety profiles, and as far as human trials initially, and then looking at the different age groups and looking at immunization when someone has that. Do they build up antibodies to protect them in the future? So really going through all those steps. I think under the typical evaluation, we would do things, different age groups, make sure we have all the right ethnicities involved in that, and people with different medical conditions and pregnancy and those type of things. Typically we'd see develop thoroughly through years of study before we release something. Because of the urgency of this, we've defined multiple populations where it is effective and produces antibodies. So the emergency use gets it all, but earlier than typically would do, but still goes through all the safety aspects and looks through risk associated with it, and really haven't seen anything. The nice thing about the vaccine also, it doesn't have some of the products in it that other vaccines have that people are allergic to, as far as egg products or animal products or things like that, and very little preservative in it. And that's kind of one of the unique aspects of storage because of that not having that preservative. So really the components in the vaccine have much less than typical other vaccines have, which is more likely to give you less reactions.
Good. And Dr. Brooks, anything that you want to add in there? Like we said, you've been doing this with the infectious disease for quite some time. This vaccine has been developed quickly. So any thoughts for you in the safety of this vaccine?
Yeah, we've all been anxiously awaiting all the different trials. And again, as Dr. Cockley has said, these have all gone through phase 1, 2, and 3 trials with over 50,000, patients in both the vaccine arms. So it has been looked at quite extensively. Again, not as long-term data as we would have hoped for, but the early short-term data in multiple patients has looked quite good. Very few serious side effects, which is great. and the amount of antibody production and efficacy has been much higher than expected. The type of vaccine is also exciting. This is a very targeted vaccine with a messenger RNA that really tells the immune system specifically what to make to target this specific spike protein on the virus. So it's very unique and really great results so far. We continue to follow this and watch this, but it's one of the most effective vaccines that we have historically compared to other vaccines, much better than the influenza vaccine. So we're very excited about that.
Yeah.
Right.
Yeah, Dr. Brooks, just to emphasize, when you say that is a lot of those other vaccines are 50 to 60% effective afterwards in those long-term studies, where this one is 90 to 95, at least the two that have been approved already. So significantly better antibody response, and hopefully that will lead to that longer term protection.
Thank you, Dr. Cockley. Again, we are getting lots of comments coming in. We're going to get to those just as quickly as we can. Please keep them coming. Again, this is your opportunity to ask questions to Dr. Cockley, Dr. Brooks, whatever you are thinking about right now in regards to this vaccine. Please leave your comments. I am monitoring those and we will get to them. Let's talk a little bit about that. Dr. Cockley, you were talking about the different doses that you need. So with this vaccine, you need the 2 doses. We have a question here from Marie. She's asking, once you get the first dose, are you guaranteed to get that second dose? And can we also talk about why that second dose is so important?
Yeah, great question, Marie. It is important to get that second dose. And the process we have set up is when you get your first dose, we will schedule you for that second dose. You'll have that appointment already for that second dose of vaccine. And with the Moderna vaccine, that's 4 weeks out. So 28 days out, you'll be set up for that. The way the state has arranged it is that they're sending us automatically that second dose. So if we get 100 doses today, in 4 weeks, they're automatically sending us that other 100 doses. So they've set those aside. So we will guarantee to have that availability set aside for you. The purpose of the second dose, one is that first dose kind of primes your immune system. So your body reacts to it, starts producing antibodies, starts producing cells that remember to make more antibodies when you're exposed again. Then when you get that second dose is when it really ramps up and creates that more longer term memory and higher levels of protection. So really about 2 weeks after that second dose is really where your immunity is built up and you get into that 90-95% range and provide some longer term protection from the vaccine.
So those 2 doses, I mean, that's not a question. You have to have the 2 doses from both of these different types of vaccine, the Pfizer and the Moderna.
Correct.
Okay, good to know. Dr. Brooks, I want to ask you specifically, you have received this vaccine. What was your experience like? I know that we've heard about some potential side effects with the vaccines, but can you share a little bit about what you experienced?
You bet. Yeah, I heard a lot of comments from staff that they really wanted to see me getting that vaccine to give them the confidence to go forward, and I can appreciate that. So yeah, I lined up the first week and boy, I had a great nurse. I had no pain with the administration of the vaccine, probably one of the best vaccines I've ever had. Usually my staff enjoys giving me the vaccine and opportunity to stick it to me. But this was a great experience. I had minimal pain in the injection site the second day. I described very minimally. I was able to do normal activities. I actually continued to work that weekend. I had no difficulty performing duties. The second day, I did have some fatigue. So I just kind of tried to take things as easy as I could, tried to hydrate. Didn't really have a fever, any other serious side effects. And I would say by day 3, I really didn't feel that I was experiencing any side effects and continued to enjoy time with my family. Took a few days off for the holidays. And I was very pleasantly surprised. I wasn't expecting any major ones, but the few side effects that I had were very minor. And just encourage you to continue to read about it, educate, talk to staff who have gotten it. We're certainly going to monitor people per protocol and report anything if you do experience it so that we know that's how we can follow this. But my experience was great here.
Thanks, Dr. Brooks, for explaining that for us. I know a lot of people have been, just seeking that information for those who have been vaccinated so far. I have a question here from Ariel. She said after she was vaccinated, she had, headache, body aches, chills, what some people experience when they actually have COVID. It's one of these rumors and maybe myths that we're hearing about. Is there any truth to that, that if you've had COVID-19, that when you get the vaccine, that it may be worse, those side effects may be worse for you?
No, not necessarily. A lot of the response that you get after any vaccine is your immune system kicking in. Some people have a more robust, immune system than others. So common symptoms can be a low-grade fever, general malaise, fatigue, sometimes some chills. So those are all common symptoms when your immune system is engaging, doing what it needs to do. It can mimic, sometimes viral symptoms. As some people say, gee, I got the flu after the vaccine, or I'm getting COVID after the vaccine. It really is just your immune system kicking in, doing what it needs to do. Remember, both the flu and the COVID vaccines are not live viral vaccines, so you cannot get the infection from the vaccine itself. But I don't think there's any evidence to say that because you've had COVID infection that the response is going to be more robust or different than other people that have not had documented COVID.
All right, good information to include there. I think that is really important. This is not a live virus. You're not going to contract COVID-19 after you get this vaccine. Dr. Cockley, can you talk for just a moment about the importance of getting the vaccine, even if you have had COVID-19?
Yeah, correct. The thought is to continue to look at getting the vaccine. Obviously, if you currently have COVID-19 and have symptoms, have the fever, we request that you wait because you're not sure if any symptoms are from the vaccine or from the viral infection you have. Right now, from what we know is that if you've had COVID-19, that you have immunity and antibodies are detectable up to about 90 days afterwards. But we're not sure what is that long-term immunity for you. So right now, when the vaccine's a little bit limited doses, that you do have some protection for the short term after having COVID-19, but that second or third month post-infection is when we're asking to get the vaccine, get that first dose and that second dose to, again, boost your immunity to hopefully provide you that longer term immune protection from the vaccine versus just having the infection. So it's important to get that there. And I think, again, from the vaccine, you're likely to have mild symptoms, kind of like Dr. Brooks had, or I think it was Ariel that had the headache and stuff. That's fairly common. Few people can have some fever, but if you start developing respiratory symptoms, coughing, those type of things, you could still get COVID-19 in the first few weeks after getting vaccine. So it's always important to get tested if you have those respiratory symptoms, or if your symptoms are more severe than you hear they should be, lasting 72 hours or very severe, debilitating symptoms, you should be checked.
Good points to make, Dr. Cockley. Thank you for that. We do have information in the comments for those who are watching. That includes frequently asked questions on our ThedaCare site. We're also linking to the Wisconsin Department of Health Services. They have a great vaccine website as well, where you can track how many doses have been sent to different places in the state. So we have those resources in our comments. Again, taking comments from our followers here, please leave your questions. We're trying to get to as many as possible. We've already had a few, and we have a lot more coming in. So I want to jump right into a comment that we keep getting and a question that we keep receiving. It's, when is this vaccine going to be available for the general public, community members? I know that this is much anticipated and people are looking forward to this. Dr. Cockley, can you explain a little bit about that information that we have right now?
Yeah, I can definitely go into that a little bit more. And I think I can see it's frustrating for people because they see the different states doing different process. Really what, the CDC's send out recommendations, here should get the vaccine. Each state is processing that a little bit differently and interpreting that. And what we're doing in Wisconsin, following the health department, was two things initially in the group to get vaccines. It's the healthcare workers, frontline workers that are treating COVID people, so we can keep those people, that resource available, not only to treat the COVID people, but also to treat the people that have pneumonia or heart disease or stroke. And Yeah, I think you can see in the news, there's areas in California that don't even have room if you have a heart attack to come in the hospital and get a bed. So we don't want that to happen. We don't want to have those resources limited. And also protecting the people in the skilled nursing facilities that are very high risk of mortality. From that, then the state is saying we're going to start rolling that out to then those essential workers, the firemen, the police officers, those type of things, teachers in that critical area. And along with that comes along the first stage in the general population, which will be the 75 years and older, which again have that high risk. So we're kind of balancing when to get to that versus getting all those 1A people completed in their vaccines, but also that continued shipment from Moderna for us for the continued vaccinations. Again, we've got to get through the first wave. They do have those second wave or second doses reserved, but then how do we get to that when we get closer to the end of the 1A? That's when we start rolling out for more people. It could be a couple of weeks still, but again, it depends on availability of the vaccine as we move forward.
Right, like we've heard before, we're sort of at the mercy of state and federal leaders when they're getting that information to us. But that's something from a ThedaCare perspective, we want to be sure that we are communicating with our patients, our families, our general communities out there. So I know we keep getting some more questions here from Linda and Chris. They've asked, are there waiting lists at this point? And we can say that there are not. Dr. Cockley, can you kind of reiterate for us that, once we have that information, that we will get that to our patients?
Correct. So what we're trying to do is get as much vaccine as we can, administer as much vaccine as we can, but doing it in a process where we can get you in, have you signed up for that second dose so we can complete it in the right sequence so you have the maximum immunity. So that's a key. What we're using is ThedaCare, our portal to that to sign people up. So we've been processing orders through that, signing people up, and then they can pick a time and location for that. So the people that are in that 1A group, it's important to have that ThedaCare app on your phone or be able to log in because that's where you're going to get your notification. Make sure your email's updated in that. So as we push that out, go group to group, and we will, with communication, let people know when we're moving on to the next model and where we're going. So more updates and keep in contact.
Wonderful. Thank you for that. Dr. Brooks, can you tell us a little bit about the people who should be receiving this vaccine? We have these different tiers, these different phases that have been determined. Can you tell us about the people who, should really be considering this vaccine as soon as it's available to them?
Right now, it's primarily all healthcare workers with direct patient care that we're trying to follow guidelines that were developed by the Vaccine Advisory Committee and CDC, really to start with anyone in healthcare who has a direct patient care with COVID at risk or positive patients, and then kind of working backward from that to eventually to include all healthcare workers. And then also as part of that, as Dr. Cockley said, to identify elderly patients in nursing care facilities right now is our second biggest group. So really, if you're in one of those two groups, you ought to really strongly consider the vaccine when offered to you. And there'll be some staging of this. We can't do everybody in the first week. So we ask for your patience and try and do the highest risk positions first and then keep moving forward. Eventually, it will move to other, high risk groups such as elderly patients that are not in the nursing home, but that's not here yet. And then eventually other patients with high risk conditions for progression. So we will keep everybody informed as we move through those first groups and are able to provide vaccination to other groups. But our main concern is the safety of our healthcare workers and frontline workers. We have been limited by staffing throughout the pandemic. So it's really vital that we keep our workforce healthy and protected. And this right now is probably our first priority. And I encourage you all to sign up for that and then continue to take all the other protective measures even after vaccination to keep yourself and also your family healthy so that you can provide care that we so urgently need you at this time.
That's a great point, Dr. Brooks. Let's expand on that just a little bit. That I know we're getting questions too, that after you get this vaccine, can you stop wearing a mask? We get that question a lot. And since there are no waiting lists at this time, there's been no information that the community or the general public will be receiving this vaccine in the next couple of weeks. What are the things that we need to be doing right now until that vaccine is available for more people?
Basically, everything you're doing now, we want you to continue to focus on avoiding large group settings, practice your social distancing, spacing, and wearing your mask when you're out in public or public places, or if you're a healthcare worker, following your protective equipment guidelines for your department. Washing your hands and avoiding touching your eyes, using the alcohol-based gels frequently are all really important, even after you're vaccinated. A good point to remember is even after flu vaccinations, people can still get flu and they can transmit influenza to family members, coworkers, and patients. We don't know how this is going to take place with the COVID vaccine. It appears to be much more effective, but it's possible you still could pick up the virus, transmit it without knowing it. This happens commonly with COVID. Patients don't have symptoms and they're still transmitting virus. So we don't think it'll be severe or long-lived, but we know this could still happen. So the additional measures are going to be required for the foreseeable future until we see the cases going way down and public health has more data to tell us, and then we can maybe change guidelines in the future. But it'll have to be data-driven and with very close observations.
Thanks so much for that, Dr. Brooks. Dr. Cockley, I have a question here from Christine, and this may be one that you and Dr. Brooks want to tag team together, but Christine is asking, will vaccines make travel easier? I know that, you know, when we were right in the beginning of the pandemic, we were talking about testing making travel easier when you could have the rapid test and then jump on an airplane. Do you think that will be similar with vaccines? Will travel be easier in the future?
I think it is one component to it, kind of with the things that have made it a little bit easier, some of the, distancing airlines of doing and things like that, and sanitizing, those things make it a little bit easier. I think it's just one more tool there. I don't think it'll make it carefree. So again, you've had the vaccine, you're less likely to get some significant infection from COVID, but you also then could carry the virus. So again, now you're carrying it from one community to another who may have higher or lower, or you're going to a community that has a higher activity right now and bringing it back to an area that's lower. So, I think it is one component, but you still need to do the masking, you still need the distancing. And really, if you have any respiratory symptoms or feel ill, you probably shouldn't travel right now. Because again, whether it's flu, whether it's something else, you're spreading it, you're not sure if it's COVID, testing does help with that. But I still think we still have to be leery of just being free will at travel right now.
All right, thank you, Dr. Cockley. Again, we're taking your comments. Please leave your questions in our chat here. I am monitoring this, so we'll get to them as quickly as we possibly can. This is your opportunity to ask Dr. Cockley and Dr. Brooks anything that you are wondering about this COVID-19 vaccine. Again, monitoring those comments. We'll get to as many as we possibly can. I do have a few comments asking about children specifically. These vaccines are not necessarily recommended for children. Dr. Brooks, can you talk a little bit more about that for us? Children probably won't be getting these vaccines very soon. Why is that? And then what can we do to protect our children?
That's a great question. This is another area where certain segments of the population really weren't included in that initial vaccine trials for either vaccine. So the pediatric population right now has not been adequately studied. Right now, there is no formal indication to vaccinate pediatric patients. I think we're awaiting more data. Trials are ongoing, so we'll be getting more data in the future. The severity of the disease appears to be much less in pediatric patients. It's not zero, but it's certainly much less compared to other groups like pregnant women, also not studied, but higher risk for progression, serious illness, preterm labor, where there are some reasons to discuss benefit versus risk for that population where one might want to get vaccinated, which OB and several societies did recommend, even in the absence of hard data. pediatrics based, a little different type of risk benefit discussion, that at this point there does not appear to be any mandate or recommendations for vaccination. I think if you have pediatric patients or family members that might be higher risk with immune problems, congenital heart disease, lung problems, I would certainly reach out to your primary care physician to review that, maybe talk with local experts in the field to see if there are, some exceptions to that rule. But this is an area that we continue to watch for updated information, and we'll give it to you as soon as we have it.
Dr. Cockley, are these conversations that you should be having with your primary care provider now? As you know, we do know that this vaccine will eventually come out to more community members. What are those conversations? What should they be like?
Yeah, that is a great question. As you're awaiting, as far as in general population for the vaccine, it is very important. And Dr. Brooks hit on several of the key points is, what is the risk and benefit versus getting the vaccine? What are the risks? Side effects, symptom wise, fever, aches and pains, feeling a little bit ill for a day or two. We will know more as that goes on, and we're continuing to collect data. But what are those benefits? And those are variable per individual. You could be a healthy 22-year-old with no medical problems, and theoretically you have fairly low risk. But then you add in why you have asthma, you have diabetes, or specific ethnic groups that have been shown to have more severe outcomes. So that increases your risk of getting the virus and having significant symptoms or morbidity or mortality from it. So you may want to put that higher in your list and get that vaccine. So, and really the best person to discuss that with is going to be your primary care provider, who's probably seen you for many years, know the risk benefits, know your family, those type of things, and have an informed discussion of when you should get it and how soon you should try to get it when it becomes available based on the risk stratifications.
Dr. Brooks, a question that we have from Mike here on our Facebook comments. He wants to know, how long will it take and how many people will have to be vaccinated to achieve herd immunity, a term that we've heard a lot throughout this pandemic. So can you explain that for us?
Yeah, it keeps coming up and the number keeps flying away from me. I mean, if you listen to Dr. Fossey, that number has changed several times. Reading through the literature, the number seems to change several times. Based on other infections, it's generally around 60% of the community. The numbers were revised to 70%. Now it seems to be even higher than that. It does vary by different types of infections, different viruses, what the contagiousness of the virus is, and the population densities. So there's a lot of factors that go into that. The honest answer is we don't know. I think it's probably upwards of 80% have to have the disease or the vaccine before we get to that critical herd immunity, or we'll see a slow in the transmission and active cases of the virus. But, nobody really knows this virus that well. We're all still learning, and we have to look both locally, nationally, and even globally what's going on to, gather that data so we have some indication when we first start to see it. So we'll let you know then.
All right, perfect. Dr. Brooks, I'm going to stick with you for this question from Christine. She wants to know, will this be a yearly vaccine, something like we have similar to the influenza vaccine?
I hope not. Initially, I was very optimistic that this would go the way of other coronaviruses like SARS, Middle East SARS, that it would eventually fade out and mutate, become less virulent, and not be a recurrent problem. But this virus is unique, it's highly contagious, it's demonstrated persistence. It's been here a year, so I don't know the honest answer for that. We will have to continue to follow this closely. It's not over, it won't be over in the next few months. We know that for sure. Whether it's going to be a regular event like influenza, it's too soon to tell. But we do have to be prepared for that, for regular vaccinations or even combination of vaccines to come in the future to really deal with that if that happens. Again, following trends in other continents like we do for influenza will give us data for early recognition and how to prepare for that, how to test for that, and how to adapt and change for that.
So it sounds like we just have to wait and see to understand more if that would be like a yearly vaccine.
The common theme with this pandemic. Wait and see.
Wait and see, absolutely. Dr. Cockley, you and Dr. Brooks have both been leading our vaccine committees at ThedaCare, a lot of work that you both have been doing. Thank you for that. Can you talk just a little bit about the planning that's gone into this? We've never experienced, we do vaccines on a daily basis, but we've never experienced vaccinating huge health systems and then eventually greater communities. Can you talk a little bit maybe about the learning experience for you in this?
Yeah, it's been very interesting. Again, it's something we haven't done before, and just the overall scope. And it's you're not trying to, eat the whole cake in one bite. I mean, you got to take, chip off what you can do. And they even think it is from receiving the vaccine. So it's not even the same ordering process that you do with your other vaccines. It's not the same storage. The two vaccines we have are stored different way to ship it. Other additional learnings you have to do to be able to be ready to administer. Obviously, with the limited experience, be ready for the atypical reactions that may happen. So, kind of set up there. But did it so we've set up very specific locations to do it. So in a controlled environment, teams trained to do this as far as, scheduling, checking people in, doing the process, observing them afterwards, making sure we're setting them up for that second one, answer all their questions, really with most anticipation that, hey, this is going to be difficult, and started a little bit slower so we could learn and make sure we did it the right way, a safe way, effective and efficient, and really have ramped up since those first few days that we've done it. So really learning a lot, ramping up, trying to order more vaccine and keep that process going. So I think what we've learned, immunizing the healthcare workers and the critical people at the skilled nursing facilities has given those tools, those learnings, have a great process to continue rolling out and ramping up as vaccine becomes available, as staff becomes available, and how do we start then partnering with the Department of Health in the different areas to make sure we're getting that vaccine quickly out to everyone that needs it.
Dr. Brooks, would you like to add a little bit in there? Like I said, you have a vast history of infectious disease. You've been through a lot of different scenarios, but I'm sure nothing like this. Can you talk about, your experience in all of this?
Yeah, this is unique. It's such a massive undertaking for a vaccination campaign, both as a system and really as a community and a public health endeavor. It really has not been seen probably since polio, really. We're used to the annual influenza vaccine campaigns for healthcare and in the community. We're all very comfortable with that. We have great healthcare workers and staff that are very familiar with the process, the operational aspects of this, but this is a new entity. The vaccine is a new vaccine with different requirements, a lot of different operational logistic issues, as Dr. Cockley has said. So it just causes us to make sure we're following the rules, dotting our I's, crossing our T's, following everything perfectly so we don't have unintended consequences, side effects, mistakes, and things. We want this to go as well as possible. I think like anything else, once you've been there, done it, seen it once or twice, things are going to get easier, move faster. But we are also under the limitations of supply and demand here too. So that will change, but we are doing, I think, the absolutely best that we can at this point in time. But it is the big picture, a huge vaccination campaign, millions of people. So the big picture is really a huge deal. We're all taking part in it. It's not just one person. Every person in this whole process is vital to the success.
Yeah, I agree. The team has been great that we've worked with, a lot of knowledge and being able to adjust and adapt to it. And I think one of the other key things is it is a precious resource and we don't want to waste any single vaccine. So we want to make sure it's, in the right temperature, we stored it the right way, we're using it quickly. And after you open a vial, you only have several hours to use that whole vial. And there's 10 doses in a vial. So at the end of the day, we have to stop on a multiple of 10 to finish the day because you don't want to end up using 5 doses out of a vial and then, whoops, now we have to store that till tomorrow and you can't use that. So we wasted 5 doses, 5 opportunities for someone to get vaccinated. So precious resource. We want to make sure we're using it effectively, not any waste, and we're getting it to those people that are in need as they're prioritized.
Thank you both so much for that. I think you both have a great perspective and a background here. Like I said, you've been leading our vaccine committees, making sure that it gets to the right people, right time. So we appreciate that. Again, taking your comments here. I have a few other questions. Excuse me for that. Dr. Cockley, this one is probably for you. Barbara is wondering when paramedics, EMTs, first responders would be vaccinated. I know some of them have. Can you explain a little bit about the fact that ThedaCare is not just vaccinating our team members in this first round, that we are including other groups that need to be vaccinated as well?
Correct. So what we're looking at is, and thanks for the question, Barbara, that people that come into the hospital provide care. So it's the intensive care workers, the COVID unit workers. So, and that's employed ThedaCare providers, but also some of the affiliated providers that come in, as far as the different surgical groups, the different primary care offices that have come in and work in the units. So we're doing that. And we have started inviting the EMTs to come in and that to get vaccinated also. So continue to spread that out. We know that they get involved in the COVID care and they pick up someone who's sick and not knowing if they're infected. So, getting them immunized, and they're in that process already. And then just kind of continue to expand that out to others that do healthcare that maybe not deal with COVID patients on the daily basis, but they provide healthcare. Sick people come in their office, so we can help protect them. So it's continue to roll that out as we can.
Good. So we are finishing up in just a few minutes. We have a little bit of time from Dr. Cockley and Dr. Brooks for a couple more questions. Please leave those in there. If we don't get to all the comments, we will try to respond to those even after this Facebook Live is ending. So please continue to leave your comments, questions. We will be monitoring those. We have some resources in our comments, links to our frequently asked questions on our website. We also have a link to a vaccine page from the Wisconsin Department of Health Services there as well. Before we go though, Dr. Brooks and Dr. Cockley, I have a few more questions for you. Dr. Brooks, I think a lot of people have been wondering this, and I know you probably can't answer it. It's sort of that waiting, but when can we get back to normal? And is there a normal as we know it, or is there a new normal for us?
Yeah, I wish I had that crystal ball, everyone. I think that's $1 million question. This is still going to take months to get through this part of the pandemic and even the vaccination phase to get everyone protected and to see the incidence of new infections really sharply decline. So you're talking several months yet. I think there's going to be a new normal. I think this is going to leave a scar for many of us and how we look at things, how we do things, what types of risk we're going to take in the future to protect ourselves, both in our families and in our communities. There's going to be a lot more attention to hand washing and protection from common respiratory illnesses going forward. That may not be a bad thing. But the exact timing of this, it is what it is. It'll tell us when it's here. Trying to predict it, we're going to be wrong. I don't like making crystal ball predictions because all you can be is wrong. So just stay tuned and do your part. I think follow the best recommendations that we can do based on data. Education is all we can do. And I'm optimistic. I know it's coming. It's just not coming fast enough for any of us. Patience has been the hardest thing during this type of a pandemic that we've all had to learn and struggle with, and just encourage you. And I'm so thankful for many of you that have reminded me of that and been patient with me and all of us during this time. So it's going to take more of that, and just make sure you take time for yourselves and your stress so that you can, be a support for yourself and for your families too.
Inspiring words, Dr. Brooks. We appreciate all that you and your teams have done for us. You've been truly leading this fight in our COVID units, and we appreciate that very much. Dr. Cockley, I have a final question for you. This vaccine is a milestone. It's a turning point, but it's not, like you said, we've heard it before from Dr. Brooks, it's not happening overnight. So what do you want the public to know right now, and what do you want them to do?
Yeah, I think it's important to know that we're rolling out the vaccine as quick as we can and as much as available for that. Getting to those high risk groups. I think, continue figure out where do you fit in that and desire and get informed of when you want to get vaccinated as it comes out. But again, continuing to protect yourself and your family, wearing the mask, distancing, hand washing. We have learned a lot, and where those vulnerable patients are, probably things aren't going to change a lot. I mean, as far as going to the nursing homes or where there's high risk people, washing your hands and doing those type of things. If you look at the national numbers for influenza, significantly down from previous years. So, obviously doing some of this isolation really decreases the spread of certain illnesses. So do we approach things differently? So, keep on top of that, keep on top of the news when the vaccines are coming out, and be ready so we can be efficient in this process, deploying it out. Pay attention what's coming out of the local health departments, because different areas of population, things may be available at different times. So be aware what's going on locally, and help protect yourself and your family. And ThedaCare will be here to do what we can to help.
Wonderful. Thank you both so much for your time today. Thank you to everyone who commented, asked questions. We very much appreciate it. Again, leave your comments in there. We will respond to them. We'll be monitoring them throughout the day here. So we'll get you that information that you need. Dr. Brooks, Dr. Cockley, thank you very much for all that you're doing for our system and our communities. We very much appreciate it.
Thank you, Cassandra.
Thank you.